I think one of the reasons why we hadn't been so as successful as we'd hoped for producing new drugs is that we're not selecting the correct patient for the correct drug. If we have very good drugs, as we do at the moment for the bronchodilation as well, and we're using bronchodilation as our readout, then we're going to not have a great readout. But I think in relation to the anti-inflammatory issues, different mechanisms cause COPD. We're taking them as every COPD patient is the same, and for that reason a drug targeting one aspect of inflammation that patient doesn't have is not surprising. The drug's not going to work. So I think we have to be more insightful about the patient as an individual and what's driving their disease, so that we can target the right drug to that patient. I think this comes back to the stratification of patients, who has a particular type of inflammation and who's going to be most likely to respond to a particular drug. So as we target those patients, we'll see that patients respond or not respond to a particular type of drug. And what we're trying to do now is, as they do in cancer, is to have an adaptive design study or approach. If you don't respond to one drug, we don't keep you on it because that's what we have. We'll change you to a different target or a different drug that hopefully of benefit. So all the time you're progressing until we find the right drug. So these studies are beginning to be used for asthma and will hopefully be used for COPD. So I think we're changing our way of thinking so that we can get the best treatment to the right patient. I think the whole issue of oxidative stress is very important. It's clearly upregulated in most patients with COPD. So there's an obvious target for this. So nitrosative stress, oxidative stress, histone deacetylases are all part of that complex. It's targeting that correctly so that we get a good therapeutic index. The drugs used to date have been not very potent and haven't been given to give enough coverage of the drug in the lungs of the patients, because they're oral drugs. We have to get enough sample or drug in. Where we have managed to do this, then we've had success in the patients. So I think this again comes down to having better designed studies to give our drugs to the right patient at the right time, giving enough of the drug into the airways to have some therapeutic effect. There are a number of very interesting drugs in development, whether they're phase 2, phase 3, looking at different inflammatory mediators and targeting specific T cell subsets. So we have, for example, CRTH2 directed agents which target these eosinophilic asthmatic. We also have other drugs that target that eosinophilic component for asthma. So I think we're getting a good number of drugs to target a subset of asthmatics, who are 40–45% of the asthmatics. We are lacking new drugs that target the other asthmatic patients, so we certainly need to progress more in that regard. There's a lot of preclinical work and very early clinical phases of drugs that are producing interesting targets, but we need to put them to patients to see whether they're going to be successful, because as we know, a lot of drugs aren't successful, but at least we are taking the right approach now for targeted therapy. In COPD, with the anti-inflammatory agents we have so far, we really look at steroids as a drug that works. As a group, steroids don't work overall for all COPD patients, but for subsets of patients they work very well. And those patients are the ones who seem to have high levels of blood eosinophils, so we can see efficacy of the steroid LABA combinations. The new drugs are really trying to target the mechanisms that we think are important in COPD. Although I must say targeting the remodeling and some of the lung destruction is going to be very difficult. Our models and approaches are coming from animals, and the translation has been difficult, mostly because we don't select the right patient. So I look forward to the next 5 or 10 years producing some very, very good, novel, exciting drugs which we will target to specific subgroups of patients, or should be targeting to specific subsets of patients, rather than treat all COPD patients or all asthmatic patients the same.